coming up, we'll be on location in Stevensonville, Maryland, discussing the latest advances in Lyme disease diagnosis and treatment, and how to correctly recognize, diagnose, and treat Lyme disease and its many associated symptoms that adversely affect so many people in our society. And in fact, Lyme disease has become an epidemic, with one of this region's top doctors, Dr. Paul Beals. Dr. Beals received his medical degree from Temple University Medical School and has over 40 years of experience. Dr. Beals is widely recognized as one of this region's top doctors. Welcome back, Dr. Beals. It's a pleasure having you on our program again today.
My pleasure, too.
We have a lot more to talk about today. We're going to be hearing from multiple patients of yours a bit later.
Right.
But before we get to them, I wanted to talk about Lyme disease because it's an insidious disease. It's extremely prevalent in our society. However, it is frequently misdiagnosed in many patients by so many medical doctors and practices who these patients may be experiencing symptoms that are adversely affecting their health, and yet so many doctors unfortunately can't diagnose that it's Lyme disease causing these problems. The issue has grown to epidemic levels, in fact. And I wanted to begin by asking you how people can get Lyme disease.
Well, the vast majority are going to get it from ticks, deer tick primarily. But the point is, where there's woods and deer and tick, there's going to be Lyme. And this country is, like you said, epidemic, because we see woods, deer, and tick all over the place. People camp out, or they go in the garden, or they go in the woods, or whatever. It's easy for them to get exposed to ticks. The other problem is people get tick bites and sometimes don't know it. The deer tick's very small. Sometimes it could be on your scalp, on your back, and fall off. You don't even know it. So it's probably one of the most underdiagnosed and when diagnosed, undertreated infectious disease in our country. It's epidemic. It's epidemic.
Absolutely. That's why we wanted the region's foremost authority on Lyme disease, you, here today, to really educate the folks in the community about this disease and different treatment plans that you offered that help so many people.
Exactly.
And as far as I wanted to follow up also with what you just said. Why is Lyme disease so frequently undetected or misdiagnosed?
Well, again, it's one of the most underdiagnosed, undiagnosed, undertreated infectious disease in our country. The problem is routine blood tests and lab tests are going to miss the diagnosis between 70 and 80% of the time. So doctors like to have documentation. The blood tests, the lab tests, and you don't do that with Lyme disease. So if it comes back negative, it's so bad, there's a law in Virginia and now in Maryland. Some doctors don't realize it's a law now. If we get a negative Lyme test, in Virginia or Maryland, we're supposed to, by law, say, just because your Lyme test is negative doesn't mean you don't have Lyme. Doctors aren't recognizing that. So it's a clinical diagnosis. People have been around woods, deer, and tick, and now they have an unexplained severe joint pain, fatigue, fibromyalgia, headache, brain fog, and they can't, all the blood tests are normal. So they can't figure out what's wrong with it. 9 times out of 10, it's Lyme disease.
And that's why it's so misdiagnosed.
Oh, very much so.
Now, please tell us, Dr. Beals, if you may, about the controversy that exists within the medical community where Lyme disease is concerned. Because there's actually a big controversy there.
That's a big controversy. The problem is there really shouldn't be, Rocco, but there are two very, very different schools of thought about how to diagnose and treat Lyme disease. It really shouldn't be. The first problem is the Infectious Disease Society has decided for 20 plus years that there is no such thing as chronic Lyme. To me, that's like saying water's not wet. Anything that lasts more than a few months is chronic. And they think if somebody has a positive Lyme test, all you need to do is treat it for 1 month and you're done. Well, that doesn't work. So the Infectious Disease Society is 20 years behind the time. Fortunately, 20 years ago, a group called ILAS, International Language Social Disease Society, set up a protocol that I follow. I've been with them 20 plus years, which recognizes chronic Lyme and co-infections. The other problem is the ticks around here, Rocco, will give you 3 infections: Lyme plus Bartonella plus Ebola. You have to treat all 3 eventually to get people better. The infectious disease people don't recognize that. So to do it properly, you have to give them 1 antibiotic, maybe a second one, and it doesn't happen overnight. It might happen over 3, 4, or 5 months. So yes, antibiotics for a long haul can be a problem, but we add probiotics. We control their diet. We get them better because one antibiotic for 1 month doesn't work. But there's two very, very different schools of thought. 90% of your doctors line up with the infectious disease people.
The schools of thought between these two societies or organizations is vastly different.
Vastly different, yes.
It really is.
But you're talking about rheumatologists, infectious disease doctors, or neurologists, and orthopedists. They all line up with the infectious disease people because that's kind of the politically correct way of doing things, but it doesn't get the job done.
Yes, indeed. Now, I wanted to also ask you, Dr. Beals, if you can please tell us what some of the health issues are that Lyme disease can cause. I know you touched on that a little briefly earlier, but if you could please elaborate.
Well, we're talking about severe symptoms. Periods of severe fatigue, severe joint pain, fibromyalgia, muscle pain, headaches, and brain fog. And this is young people, teens, 20s, 30s, 40s. And if it goes untreated for very long periods of time, it gets so bad 2 or 3 years down the road, Rocco, some of these young people end up in wheelchairs, some worse than that. So I had a couple of young people a couple of years ago, 20-some years old, end up in wheelchairs in my office. They were Johns Hopkins rejects because Johns Hopkins infectious disease people don't recognize chronic Lyme. Neither do most other doctors. I'm not pointing them out, but just the problem is it's a vast misunderstanding. We got them better in 3 to 6 months, but it didn't happen overnight.
Yes, indeed. But what's 3 or 6 months or even longer to get recovered from Lyme disease and all the negative, debilitating issues it results in? And we're going to hear from some of your patients shortly on that.
Yes.
Now, when Lyme disease goes untreated, it is frequently misdiagnosed, as we just talked about. I wanted to ask you if you can please tell us what some of the most common health issues it is misdiagnosed for. What do people think that individual has?
They'll call it unexplained arthritis or severe muscle pain. They like it with fibromyalgia. You're excessively fatigued, so you have chronic fatigue syndrome. Or maybe you have some MS, multiple sclerosis type symptoms. Early onset brain fog. And the list goes on and on. So they like to tag it with different diagnoses because, well, you had a negative Lyme test, therefore you don't have Lyme. That's the wrong answer. We have to say just because your Lyme test is negative doesn't mean you don't have Lyme. That's how bad the tests are. But doctors are reluctant to say that, and then they miss the diagnosis. And all the other blood tests are normal. So I don't know what's wrong with you, they say, but it's not Lyme disease. That's the wrong answer.
And then they prescribe the appropriate treatment plans for those issues that they think that particular patient has, and nothing comes out of it because they have Lyme disease. They don't have one of those other issues.
Or they just treat the symptoms, like you said, and that doesn't work for a lot of them as well.
Absolutely. Now, that leads me to your unique approach, Dr. Beals, that you have here at your practice, that you've utilized for so long to help so many people when it comes to testing patients for Lyme disease. Can you please tell us about that?
Well, unfortunately, we're running into the same roadblock because the routine blood tests and urine tests are going to miss the diagnosis most of the time. Now, there is a lab in California that's about 70 or 80% accurate, but they might cost the patient, $700, $800 out of pocket. So what we say, Lyme disease is a clinical diagnosis, not a laboratory diagnosis. So the way people know they have Lyme disease is a very unique situation happens when you start treating somebody with Lyme disease, called a Herxheimer reaction. We only see this when treating people with Lyme disease. No other infection will do this. After a week or two on antibiotics, at some point they get a die-off reaction because they're killing more bugs. And this die-off reaction shows up as a temporary worsening of your symptoms, called a Herxheimer reaction, named after Dr. Herxheimer when they were treating syphilis. You have Lyme disease. There's no other infection out there that will make you feel temporarily worse for a few days before you feel better.
After they've been on the antibiotics.
After they've been on the antibiotics to killing off more bugs. So to say, how do I know I have Lyme disease? Wait around. Within 2 weeks, you'll feel temporarily worse, after which you feel better than you did before. It's like 3 steps forward, 1 step back kind of thing.
Gotcha.
Almost always happens and almost always confirms this person has Lyme disease.
And what are some of the most effective treatment options available that you utilize to help folks with Lyme disease and chronic Lyme disease?
And chronic, that's a key word. Chronic Lyme is requiring long-term therapy, 3, 4, 5, maybe 6 months. And I follow the ILADS protocol in the National Lyme Associated Disease Society because we start with one antibiotic, but if you stay on one antibiotic too long, the bug becomes resistant to it, so you have to add a second one. Eventually, you have to add something to kill the cystic form of Lyme, like Flagyl. When we're done with that in 3 or 4 months, then we have to switch horses and go after the co-infection, like Bartonella, which requires a different drug, and Babesia requires a different drug. So, in addition to treating Lyme disease appropriately over a period of several months with multiple antibiotics, we treat the whole person. Most people are low in B12. Most people are low in vitamin D. We give them supplementation. Most people have the worst diet in the world because the American diet is worse, which is sugar and high fructose corn syrup. Clean up your diet. Here's how you should be eating. Exercising. Take some supplements. Get your B12 and vitamin D levels up, etc., etc. So we like to treat the whole person. And sometimes with Lyme disease, we'll look for heavy metal toxicity. But it's mainly lifestyle changes, get off the cigarettes, curtail your drinking. You want to get better, you got to discipline yourself.
Yes, indeed. It's all of that.
That's all of that.
Yes, hence the integrative approach that you utilize.
Got to be all of it.
Now, you mentioned 3 to 6 months, some cases a little bit longer, as far as when the patient starts seeing results, especially from chronic Lyme disease. Is that pretty much typically the range?
No, they'll see results within a month or two.
Okay.
But within 6 to 9 months, they're 75, 80, 90% better.
Oh.
But you'll see results early on. Within the first month or two, they feel worse for a while, then they start feeling better.
We're now going to hear from some patients of Dr. Beals. Welcome, Vivian. It's a pleasure having you on our program today.
I'm happy to be here.
Well, we always appreciate it when patients take time in their busy lives to come down and share some of their experiences with us. And on that note, I'd like to begin, if I may, Vivian, by having you please tell us what health issue or issues were you experiencing that brought you here to Dr. Beals?
Well, before I came to Dr. Beals, I was told that I had chronic Lyme disease. And by the time I saw him, it had become very debilitating. I had been bedridden for about 2.5 years. And from what I know, apparently the spiralkeets had buried so deep into my body that it affected nearly every system.
I'm so sorry to hear that. 2.5 years you were bedridden.
Yes.
And you had gone to other doctors, I would imagine, right?
Yes,
to find out what was causing this extremely debilitating illness that you had.
Yes.
Disease that you had. So then what happened? How did you hear about Dr. Beals and what made you decide to come here?
Well, after I had tripped over into the chronic phase of Lyme in 2014 and had become bedridden, and then my first doctor discovered that my adrenal glands were failing, so she treated me for that. And then she knew of another doctor that was coming back into town and setting up his practice as she was getting married and moving to Florida, so she had me go see him. He discovered that my digestive system, I wasn't absorbing foods. My immune system was so bad that it had turned on my body and was eating away at my lower intestinal lining. He found that I was magnesium deficient, vitamin D deficient, and then he had tested me for Lyme disease along with all those other tests. But it had come back negative with the CDC standard test. And he found that my body was racked with inflammation and I was basically declining. So by he began treating me with like nutritional supplements and herbal treatments. And that began to caused me to have what I didn't know at the time were Herxheimer reactions. Then by the time I got to November of 2016, well, by July, I was able to get up and walk again. But I went out of town and walked around a lot, and then the 18 months of energy that I had amassed completely went away. So I was back bedridden for four more months. So that doctor had me take the gold standard test in alternative medicine, IGeneX, and it came back unequivocally positive for Lyme. So, but he didn't treat Lyme patients. So thankfully, to God above, for me, My husband knew someone on his job who recommended that I come and see Dr. Beals because they too had gone through chronic Lyme disease.
My goodness, I have to tell you, Vivian, I am so sorry to hear what you were experiencing those last several years. I mean, not only bedridden for approximately 2.5 years, but all the other symptoms that you were experiencing, how it was not only dramatically impacting and affecting your life, but of course, all your significant others, family, loved ones were experiencing it through you.
Exactly.
By having you go through that. So then you came to Dr. Beals, and then what took place again?
When I got here to Dr. Beals, he immediately began me on treatment. And he continued me on the many nutritional supplements that I had previously begun. And then he continued with he put me on a gluten-free, casein-free diet and began me on many. I have about like a list of at least 10 to 15 antibiotics and other medicines that he began me on. I began the IV Myers cocktail with glutathione treatments. And over the course of time, all of 2017, all of 2018, and this year, 2019, I was able to get back involved in my family's life as a result of seeing Dr. Beals and his wonderful staff.
Oh my God, you're walking? Because obviously you walked from your car over here.
Exactly.
And here you are smiling.
Yes.
I see a glowing, energized young woman in front of me here, a young lady who's so happy, and we're so happy to see you like this after what you were going through previously.
Yes.
So it's like a night and day difference, dramatic difference that you've experienced since coming to Dr. Beals in your life and quality of life.
Absolutely, it's 1,000 times better. I'm able to attend my daughter's volleyball tournaments again, whereas I couldn't before. And I'm able to laugh without severe stomach pain and nausea and resulting weakness throughout my legs and horrific head pains coming on. I'm able to talk longer, as you can see from just sitting here.
Yes, we're having a wonderful conversation now.
Right, because any use of the muscle would cause just significant pain and just a debilitating downward spiral. Now I am able to do a lot more than I could, and Dr. Beals, I'm still sticking with him because he's helping me with new treatments, the hyperbaric oxygen therapy chamber treatments that I passed through him, and he's allowing me to do an additional IV Myers cocktail, glutathione, amino acids. Amino acids treatment that's helping my muscles to revive and strengthen after a lot of activity.
Yes.
Because that's the point where I am at now, where after a lot of activity, I have to be very careful. But Dr. Beals has gotten me to this point, and I cannot tell you how thankful I am. I love coming here because he keeps me laughing, and his staff is so sweet and they're so helpful, and they're conversational, and they just help me like just perk up when I come here. And they are just a great bunch of people, and I can't even tell them or anyone how thankful I am that I know the Lord above led me here to them based on my personal experience and path. And I know if I hadn't made it here to see Dr. Beals, that I would probably not be sitting here with you today, because I was that far off and far along into the Lyme stages that it was just getting worse from there. And
yes,
so
indeed.
I'm thankful.
Well, we are so happy to hear what you just told us. and where you are today in your life. You have your life back again.
Yes.
That says it all.
Yes.
And on that note, I would like to thank you so much, Vivian, for taking the time to come here and really share your story with us, with all of us. And we just want you to continue on the path that you're on now, where you have your life back and your loved ones are right there with you, and you're there experiencing their lives, like the volleyball tournaments with your daughter, for example.
Yes.
And really want to thank you for joining us and being a guest on our program. It was a great pleasure having you on with us today, Vivian. Thank you again.
Thank you.
Welcome, Rick. It's so nice to have you with us today as well.
It's great to be here as well.
Now, I wanted to begin by asking you the same thing we just asked Vivian a few moments ago, and that is if you could be kind enough to please tell us, Rick, what health-related issues were you dealing with that brought you to Dr. Beals as well?
Well, I felt like something was wrong with me for probably 2 to 3 years. And I had mentioned it to a couple of people, my parents and whatnot. I just couldn't quite pinpoint it.
What were some of the symptoms? What were you kind of experiencing that didn't feel quite normal, if I may ask?
Fatigued, and I work like, believe it or not, 16-hour days on
Okay.
2 businesses. One's a trash business, one's an excavation business, so it keeps you busy.
Yes.
I just abnormally felt wore down. And I knew Geritol wouldn't fix it. So anyways, I started having muscle pains, and then it just kind of went from there. I just started falling downhill, and I went to the hospital 5 different times, a local hospital, and I had acid reflux and heart palpitations so bad that I had to get on the ground several times. I went 5 different times within 6 months. And they kept saying, I just don't know what's wrong with you. Well, what got me was I avoided going as long as possible because my insurance only covered sickness, not wellness. And they couldn't determine what was wrong with me.
Yes.
So each visit was about $50-some
Oh my
It
goodness.
was killing me. But anyway, I had heart palpitations, acid reflux, headaches, mostly in the back of my head, about where my spine goes up in my brain.
Okay.
And I had real bad knee and hip pain.
And these are all things that you really hadn't experienced prior, anywhere close to the level that you were suddenly experiencing them, with one thing after the other starting to pop up.
Yeah.
And that's when you went to the hospital, as you said, multiple times. Unfortunately, they didn't give you they didn't identify the cause of those issues.
They couldn't diagnose me with it. They just. So anyways, I have a relative that had it several times, chronic.
Okay.
And she said, I called her after having a massive headache one day where I was bedridden, just all of a sudden. That was my first real attack. And my head felt like someone had parked a car on it, we'll say. So I called her and she says, you have Lyme. So I said, what do I do? And she goes, you need to go to Dr. Beals.
Oh my.
That was her doctor. So
Yes.
She had real good results with him and his staff as well. So I did. And
So he was referred to you, just like Vivian, who we just heard from a few moments ago. Dr. Beals was referred to her through her husband, and in this case, obviously, she referred you to
yes, as
Dr.
well.
Beals. And then you came here, and what happened, Rick?
He had put me on medication, and when I started the medication, it just really ramped it up. It's like that stuff got really mad about the medicine I was taking.
Yeah,
So
it was fighting it in there.
it started hurting everywhere.
Yeah.
I mean, the headaches were more often, sometimes all day, and it brought on anxiety so bad and sleepless nights to the point where I'd literally start freaking when it was time to go to bed around 1 in the afternoon, knowing I wouldn't go to bed till 11 at night.
Yes.
That's how bad I was mentally.
Wow, yes.
And it brought the headaches on, the palpitations got so bad when I laid down I had to sit back up. I would literally get two hours of sleep a night for probably up to 90 days.
So you were really going through a lot at that time.
It was terrible. Then my gallbladder went bad.
Yeah.
So it was making me even sicker, and Mr. Beals called me and goes, I know why you've called me several times between appointments. He goes, you need to have your gallbladder checked. So I did. It was bad. So then I had it removed. And with the anxiety going to an operating room, you wouldn't imagine what that felt like.
Oh my goodness! First time
Felt like
probably
you were
for
being
you.
locked in a cage, and you were a mouse, and there's 10 cats standing around you.
Yeah, that's right.
But I remember that well, and I usually stayed outside where I could move and not have my anxiety so bad.
Yes.
But as time went on, it probably took 7 months, 8 months before I had a good day an okay day with my headaches, my palpitations, my stomach bloating, and all the rest of the symptoms that it gave me.
And that was with the treatment plan
Yes.
that you were already going through with Dr. Beals. And so about 7 months or so, because of how chronic your condition was with
Correct.
the Lyme disease, it takes some time to undo all that had gotten into your system through the Lyme disease.
It was bad.
Then after about 7 months, you started feeling better. And then what happened after that, Rick?
I started having like 2 good days. For some reason, when it rained, I'd have a bad day. Or if it rained 2 days, I'd have 2 bad days. But it just started generally clearing up. And then one day, it came probably around my 10th month, and it just hit me at the gas pumps, and I could smell. And I just, everything felt like it was when I was a teenager, just all of a sudden. And I just started crying.
Oh, boy. I don't blame you.
And this girl was standing by the gas station. She goes, "What's wrong? What's wrong?" I said, "Nothing. I feel great." And she's like, "Okay."
Yeah.
But that was my first good day after all the treatment and stuff. And at that point, it started going away. And it seemed like if there was no pain, there was no gain to me.
Yeah.
So as he took the medications and changed them from one antibiotic to another, and I studied all this as I went along, and I talked to other doctors, and they said, and even a pharmacist I had talked to, and a doctor in Australia through the pharmacist had told me that the treatment that I was taking was the right way to get rid of Lyme.
Yes.
Because everybody I've talked to has always said it never goes away, and I'm like, well, now I'm a believer that it does.
Yeah.
My bones don't crack, my stomach's not killing me every minute of the day, my headaches are gone. I think Mr. Beals is probably one of the best doctors I've ever heard or seen, because I think he saved my life. He helped me through a horrific thing, and I'll tell you, I recommend anybody that has any Lyme symptoms to come to him, because I've offered this to a lot of my customers just based on the area that we live in. There are ticks everywhere.
Yes.
And it's a highly infected area based on stats from the pharmacist that I went to and other people in the area. And I think that he does a great job. And from hearing about other therapies that other doctors in our area would not get rid of Lyme. It'd be never ending. Just, you go on the medication for 30 days and then it gets a little teeny bit better for people that aren't chronic, then it comes back. They call it reoccurring Lyme. It's just, it hasn't been taken care of. It hasn't been treated long enough.
Yeah.
So
Well,
he knows all this.
So here, he not only treated the Lyme disease, but he got rid of the Lyme disease
I
through
believe so.
the treatment plan to the point where you're Lyme-free,
Yeah.
right? You
Yeah.
got your life back as well,
Yep.
just like Vivian and some other folks we're going to hear from today. I am so happy to hear this, Rick. Dr. Beals was obviously a lifesaver, literally, for you.
Yes, absolutely. I wouldn't be here if it wasn't for him.
Yes.
And the staff, they're great. They talk to you. I mean, I was just a mental basket case at one point in my therapy. And I'd call and the girls would talk to me for a couple minutes and just reassure me, certain things, that it'd be okay. And this is the part of the therapy you're in, and it just helped me get through it. And they're absolutely the best.
Well, on that note, I would like to thank you as well for joining us and sharing some of your experiences and being a guest on our program as well. Rick, it was a great pleasure having you on. Thank you.
Happy to be here.
Thank you.
Thank you.
Welcome, Anna. It's a pleasure having you with us today as well.
Thank you for having me.
Oh, thank you for joining us. And I wanted to begin by having you please tell us, Anna, what issue or issues you were going through that eventually ended up leading you to Dr. Beals.
Okay. Well, I'm a registered nurse, and about 2010, I started experiencing some weird health problems. And they weren't really problems that I could put my finger on, or weren't really enough to go to a physician and explain myself. So for example, I was having sharp shooting pains going down my back that would actually feel like I was going to be paralyzed, and they would take me down to my knees. And so the problem started progressing. They started turning into like neurological problems, tingling in my feet and legs, ringing in my ears, tiredness. And then I went to a chiropractor, and she suggested that I go to a naturopathic physician.
Okay.
I went to him. I went to my primary care doctor. He kind of screamed at me, and I would constantly do like self-research, study, was it because I ate this food? Was it because I drank this? Because I did this? And so I could sort of come up with things to make me feel better, but it would only last for so long. The problems kept coming back and getting worse. And then I went to the naturopathic physician, and I was diagnosed with Lyme disease, although my test did not come back CDC positive. So after that, I did see a physician in Washington, D.C., who I really liked very much, and he treated me very aggressively for the Lyme disease, and I was very ill. I could not work. However, when you do have the Lyme disease, the treatments are aggressive, the side effects are major, you become very ill, and I don't know how people who are not in the healthcare field can even manage it at home by themselves, because you don't really have a primary care doctor in conjunction with the infectious disease doctor to help you along. So then one of my classmates from high school, I went to a high school reunion, and I was still suffering with the Lyme disease, and we struck up a conversation, and he had mentioned that he had also had it and that he had been going to Dr. Beals. And so I came to Dr. Beals. It'll be 3 years. And again, I love my doctor in DC, but it was far away, and it was only treating the Lyme. And so with the Lyme, you have a lot of other things that coincide with that, hormone deficiencies, anything else. So what I love about Dr. Beals is that he can not only treat my Lyme disease, but he can also be my primary care doctor as well.
Yes. So you really got the benefit of both through coming to Dr. Beals.
Exactly.
And what was the treatment plan that he prescribed, that customized to help you with your particular chronic Lyme disease?
Well, we looked at diet. We did hormone testing. He tested me for heavy metals, which I tested very high for lead. He put me on some supplements for that. We do IVs on occasion, the Myers cocktail and the glutathione, which is very helpful for detoxing or giving you a boost of energy. Hormone testing, hormone therapy.
So really an integrative approach is what Dr. Beals utilizes and customizes the different treatment options to help each particular patient and what they're experiencing and going through to really help you get better, not just to treat the Lyme disease, but to hopefully eliminate it and get it out of your system.
Exactly. And the accessibility to Dr. Beals, I can call the office anytime. They know who I am when I call. They know, what I need. Dr. Beals gets back to me right away. I was just hospitalized with a kidney stone. I can call Dr. Beals, call the office. They're always there for me. And not only that, they're there as advisors sort of in every capacity, because when you're dealing with a chronic illness, it affects every aspect of your life. So to have a doctor to be able to talk to you on certain levels, on personal levels, as well as, being your physician, it's, it's super helpful. And it's,
Well, you've got that trust that you've developed with him and the staff here, and you're very comfortable coming here. And as you mentioned a few moments ago, unlike the DC doctor, this doctor is very close to you.
Very close.
Yes, indeed. Yes. And so how do you obviously look and sound like you're feeling really good right now? Is that how you are?
I am. I'm doing much better. I've made a lot of progress. It is a chronic condition that you do have to deal with forever. So there occasionally are some setbacks, and whenever I need, whenever I just have the funniest little thing going on, I can reach out to Dr. Beals, and we always, constantly make adjustments according to what I need at the time.
Yes, to keep you symptom-free, right? And your quality of life, I take it, is back and
much better.
You're working again, right?
Yep.
All of that.
Yep. Wasn't able to work for a couple years. And being in the medical field, I lost a lot of friends, that were colleagues that were physicians because they don't believe in the Lyme disease.
Yes.
And
isn't that amazing?
it's amazing
That there are doctors that don't believe that Lyme disease exists.
It is
You
amazing.
just mentioned a couple of examples. I've heard that elsewhere as well. It's just amazing because this is such a horrific disease, right? And it really it just takes the whole quality of life is gone. You can become totally debilitated, bedridden, like we just heard from one of our patients earlier today. And not just affects your life in a very negative impact manner, but also friends, family, significant others are all going through it with you while you go through it.
Right. And, doctors say, I'm a scientist, I have to see the research. Well, there is not enough research. So in the meantime, what are patients like me supposed to do? Wait for a doctor to find some research? No. A doctor has to be trained well enough to use their instincts, their clinical assessment skills, taking a patient's history, going beyond all of what a regular physician would be willing to do and have the time to do.
Absolutely. And before we let you go, Anna, is there anything else you'd like to share with our viewers?
I just can't stress enough how much Dr. Beals means to me, how much he's changed my life, the staff here, how comfortable I am. If anything happens to Dr. Beals, quite frankly, I don't know what I'm going to do. I think he's great, and I don't think I could be this far and doing what I'm doing in life without the treatment from Dr. Beals.
Yes, indeed. Well, on that note, we'd like to thank you as well for joining us and sharing your experiences and being a guest on our program. It was a pleasure having you on.
Thank you.
Thank you, Anna. We're now back with Dr. Beals. I must say, Vivian, Rick, Anna, all extremely happy with the results.
Yes.
In Vivian's case, she was bedridden literally for 2.5 years. You are really a lifesaver with what you've done, not just for these 3 patients, but what you're doing each and every day for so many patients that are coming to you from throughout the region, Dr. Beals. Some great work indeed.
Thank you.
Now, I wanted to also ask you, Dr. Beals, if Lyme disease is something that can eventually be cured.
Yes, and that's a controversy about that because doctors treat somebody has a positive Lyme test, which happens once in a while. So they treat them for 1 month and stop. They start to get better. They stop the antibiotic, their symptoms come back. They're not going to cure those people. Then they just treat them symptomatically. Then that's where they get worse and worse. May end up in a wheelchair. If you take it to the extreme end, 6 months, 9 months, 10 months, when 90% of your symptoms are gone 90% of the time, and now you have no herpes reactions, you're done.
Yes.
So you've got to take it long enough to get past that point. Now, the problem is, once we cure people with Lyme disease, and we have about a 90% success rate, next year you get another tick bite, you've got to catch it right away and knock it out in 6 weeks.
Yes, as opposed to letting it fester and grow and all the problems where it becomes chronic again.
Thank you.
Now, we're literally out of time, but I wanted to ask you, Dr. Beals, before I let you go, you and your practice here in Stevensonville, Maryland, have certainly established a reputation for excellence. You're one of this region's not only top doctors and integrative health and wellness practitioners, but you are one of this region's pioneers and foremost authorities when it comes to Lyme disease and chronic Lyme disease. And you've helped so many people. You've got patients coming from throughout the region and even beyond to seek out your expertise. And I just wanted to ask you what you feel really helps separate you and your practice apart from many of the others.
Well, again, having more tools. That's a good question because other doctors don't feel comfortable using the tools they weren't given. The only tools are drugs and surgery. They have to write a prescription for everything or recommend surgery. And I'll do that for my patients if necessary. But like I say, I go the extra mile, and when you have more tools, you can do more for your patient. And we got a lot of tools. I've done this 35 plus years. IV tools, nutritional tools, homeopathic tools, herbal tools. So, and dietary changes and heavy metal detoxification and so on and so forth. There's a whole wide world out there of holistic medicine that most doctors are clueless because it's not taught in medical school.
Yes. Well, you're combining the best of both
worlds.
Western and Eastern medicine, holistic medicine, and wellness,
Right.
integrative medical services and wellness services. You really are quite the doctor,
Well,
and
thank
you combine the best of all,
Thank
right down to your bedside manner with your patients. They love you. They really do, you and your staff. And on that note, we'd like to thank you again,
You're welcome.
Dr. Beals, for joining us
Okay.
and educating us on a very important
Oh, yes.
topic. And I think after a lot of folks watch this interview, they're gonna seek out the help, because a lot of people, as you said at the beginning of this interview, don't even realize
know it.
they have Lyme disease, which
Right.
could then turn into chronic Lyme disease. So thank you again for
My
being
pleasure.
here
Thanks
today.
for having this progress. Yeah.
Our pleasure.
Okay.